Good morning, students. This is a brief review of your Exam 1 for Chapters 1, 13, and 14. This is Part 1 of your review. So we will review what psychology is, what psychologists do, identify contemporary perspectives, identify the key historical figures in psychology, and review the early schools of psychology. We'll also discuss research methods and research ethics in psychology. So if you recall, psychology is defined as the scientific study of mind and behavior. And it comes from a Greek word meaning psychic or logos. It's the study of the psychic, the mind, and the biology. Remember that Wilhelm Wundt was one of the early founders of psychology, and we will talk about him a little bit later. So some of the key figures in psychology. Remember that Margaret Flo Washburn was the first woman to receive a PhD in psychology, and Mary Whitney Calkins became the first woman president of the American Psychological Association, which governs all psychology programs and activities. And remember that women were once not admitted into the psychology program. So what are some of the early schools of psychology that we remember? Structuralism, you remember, was started by Edward Titchener, and he was trained by Wilhelm Wundt. And the goal of structuralism was to study consciousness, experiences, and its structure through methods of introspection. In other words, systematic introspection is where one could look inside of himself to gain his own insight. Functionalism, you recall, was founded by William James. And this goal was to study how the mind works in allowing an organism to adapt to the environment. Psychoanalysis was another early school of psychology, started by Sigmund Freud. And this goal was to explain personality and behavior to develop techniques to treat mental disorders. And we will review him a little bit later when we talk about the psychological disorders. Behaviorism, founded by John B. Watson and B.F. Skinner. We'll also review him too. Contemporary perspectives in psychology. Recall that the evolutionary perspective focuses on the evolution of behavior and mental processes. It also suggests that human social behavior, such as aggression, mate selection, has a hereditary basis, and when these behaviors are adapted, they're passed on across generations. The behavior perspective, John B. Watson and B.F. Skinner. It's focused only on observable behavior in controlled experiments. They study the principles of behavior modification, how actions are changed by reinforcement and non-reinforcement. We talk about rewards and punishments, and you will have a couple of examples on your exam, so be sure to study those. Psychodynamic perspective. Focus on the psychological problems that are best solved through insight through the unconscious mind. And again, we go back to B.F. Skinner and Sigmund Freud. Sigmund Freud, personality structures the id, the ego, and the superego. Remember, the id is that pleasure principle, instincts and drives, instant gratification. Ego is that rational part of our personality that governs the id. The superego is the moral aspect of our personality that governs both the id and the ego. So be sure to study those. Another contemporary perspective is the humanistic perspective. Recall that it was founded by Carl Rogers and Abraham Maslow. He believed that humans had the potential for their own self-awareness, choice, responsibility, and growth that they can gain insight into their own problems. And he started what was called a hierarchy of needs, which you have to satisfy the basic need before you can achieve that total self-awareness. The sociocultural perspective, remember, addresses the many ways in which people differ from one another, and it studies ethnicity, gender, socioeconomic status on behavior, and mental processes. So remember that ethnicity and culture and gender, they're all related. Other contemporary perspectives in psychology recall that the biological perspective is concerned with how the brain and nervous system underlie behavior and mental processes. And it relates behavior to electrical and chemical events taking place inside the body. And we talk about those neurotransmitters in the brain that keeps our brain functioning and balanced. The nervous system, the brain, and the endocrine system are studied to determine the biological causes of behavior. And if you recall, many of the psychological disorders that we will review has biological underlying and underpinnings. Key assumptions of the cognitive perspective, if you recall, includes individuals who suffer from mental disorders have all of these distorted and irrational thinking styles, which may cause maladaptive behavior. All of these faulty thinking. And it's usually the way you think about the problem rather than the problem itself, which can cause the psychological problems. Individuals can overcome mental disorders by learning more appropriate cognitions and thinking processes. The eclectic approach, you recall, uses all more than one perspective to solve psychological problems in individuals. And they don't rely just on one particular technique to help individuals. And so the eclectic approach, the therapists may pull from the sociocultural, the biological and physiological, the cognitive, the psychoanalytic or psychodynamic, the humanistic, as well as the evolutionary perspective. Now, the scientific process, make sure that you know that the steps in the scientific process, which begins with a theory. And remember that a theory is nothing more than a belief, something that you believe about, something that you want to ask questions about. Then you form your research questions from your theory. From that research question, you form a hypothesis. And you're going to examine the research questions. Then you will test your hypothesis, your evidence, which is your data collection, and you want to draw a conclusion. And once you draw that conclusion, you may be able to modify your theory or come up with a new theory or a new research question or hypothesis. Now, we also talked about research methods in psychology. The case study, remember, examines a group of individuals or a single individual. They look at their behavior, the mental processes with specific persons or situation. And also remember that the case studies are not very reliable because the individuals are not going to really disclose everything that the researcher is looking for. Remember that surveys are nothing but questions, standard questions. They ask a lot of participants to gain descriptive and numerical data to generalize to a population. Remember, correlational studies examines relationships between research variables. Remember, a variable is nothing but an item that you want to test. And There is a correlation coefficient, which is nothing but a number that determines the strength of the relationship between. The closer the variable is to plus 1.0 or negative 1.0, it determines whether it is a positive relationship or a negative relationship. Then there is the experimental method, where the researcher manipulates independent and dependent variables. And of course, we will talk about those in the next few slides. Now, examples of the correlation method. In a positive correlation, remember the relationship between variables in which one variable increases and the other one also increases. Example, in these graphs, as you can see, grade point average and the number of hours spent studying. That has a relationship, that there is a correlation between getting good grades. Then in the negative correlation, there's a relationship between variables in which one variable causes and decreases as the other one also decreases. Example, grade point average decreases with the number of hours played. So the less hours that they spend studying, the grade point averages stop. And of course, zero correlation. There is no relationship between variables. Recall that correlational methods only predicts behavior and future behavior, and it cannot determine cause and effect. But in the experimental method can determine cause and effect. All right, research ethics. What must researchers do before they can conduct an experiment? Remember, they must first obtain approval from an internal review board to ensure that all the elements are included to prevent harm to the human subjects in the study. These guidelines also include an informed consent, where the participants must be made aware of all the information about the study, the nature of the treatments, and any harm that might be there. But they must also minimize harmful effects to participants, avoid deception in certain cases, avoid promoting promising inducements, which means that the researcher must not offer any monetary incentive for participants in the experiment. Then the researchers must also grant participants the opportunity to drop out of the study if they wish at any time. Debriefing researcher must disclose all details of the study after it's complete. One thing that we have not listed is confidentiality. Confidentiality and anonymity of the participant must also be maintained. Once the experiment is complete, the researcher must communicate the results to the general public, and he must do this by publishing in a scientific journal after being peer-reviewed. All right, so that's basically all in that chapter. Psychological disorders is defined as having a significant disturbance in thoughts, feelings, and behaviors. And according to the American Psychiatric Association, it's also classified where the disturbance reflects some kind of biological, psychological, or developmental dysfunction. The disturbance must lead to significant distress or disturbance in one's life. The disturbance do not reflect expected or cultural approval responses to certain events. What's culturally acceptable in one country as being abnormal is considered normal in another country according to cultural beliefs. How do you define the presence of a psychological disorder? Hallucinations, They may hear voices, feelings of depression, difficulty eating or sleeping, feelings of restlessness, or even contemplating suicide. So some of all of these may be present in the various psychological disorders that we talked about. Now, some of the one that we talked about was an anxiety disorder, which is characterized by excessive or inappropriate anxiety reactions such as worrying, fear of the worst happening, fear of losing control, and the ability to relax. And we talked about social anxiety, we talked about generalized anxiety, and we talked about different phobias. So make sure you review the symptoms of anxiety disorders. We also talked about dissociative disorders, which are characterized by a separation of mental processes such as thoughts, emotions, identity, memory, or conscience. And the origins often arise from anxiety in their childhood, traumatic experiences, or, or other sources of psychological pain. And we talked about dissociative identity disorder, dissociative amnesia. So make sure you review those. Somatic symptom and related disorders, which are a class of psychological disorders involving physical ailments or complaints that cannot be explained by organic causes, or that involve exaggerated concerns about the seriousness of these symptoms. And some of the causes can include hysterical underlying struggles between opposing motives in the unconscious mind, sexual aggression impulses of the id, and forces of restraint by the ego. And we talked about conversion disorders, and we talked about other eating type disorders. So make sure that you know these somatoform disorders. We talked about mood disorders, which are a class of psychological disorders involving disturbance in mood states, such as major depression and bipolar disorder. Make sure you know the signs and symptoms of major depression. You will have a case study to identify. And it's really one of the case studies that you've already done. Psychological factors include changes in reinforcement levels or even their distorted ways of thinking, depressive lifestyles, stress definitely, biological functioning disturbances, those neurotransmitters that we talked about that keep the brain functioning, and definitely genetic influences. Women are more than men are likely to be diagnosed with depression. So make sure you review the signs and symptoms of depression. And again, personality disorders, which are a class of disorders characterized by enduring patterns of maladaptive behavior that are sources of distress to the individual or others. You have biological factors, which is genetic and physiological. You have less gray matter in the prefrontal cortex of the brain, provide lower than normal levels of arousal, paranoid, schizophrenia we talked about, make sure you study those. We talked about antisocial, study that. We talked about schizotypal and avoidant personality. Make sure you review those as well. We talked about schizophrenia, which is a chronic disorder characterized by loss of control by thought processes and inappropriate emotional processes, disturbed perceptions. Symptoms include disorganized thinking and speech. Their positive symptoms include hallucinations, delusions, agitation, inappropriate giggling. Negative symptoms shows no emotion. They have blank faces. They have absence of appropriate behavior. They speak in monotone voices, and they have motionless bodies. So we talked about paranoid type. We talked about catatonic, waxy flexibilities. So make sure you review the signs and symptoms of schizophrenia. And definitely we talked about suicide. We talked about that suicide is the leading cause of death after motor vehicle accidents. After motor vehicle accidents among young people 15 to 24 years of age, and those most at risk for uh, for committing suicide, middle age and older adults. Males age 75 include the gender. Women attempt suicide more, but men complete suicide more. And of course, suicide, some risk factors or warning signs, feelings of depression, downcast mood, helplessness, hopelessness, psychological problems, confusion about their own self concept, very impulsive, and definitely their interpersonal problems that they have difficulty with on a daily basis. So, this is the end of part one, psychological disorders, research methods, and history of psychology. Be sure to review these areas before your exam. Part two, we'll talk about methods of psychotherapy.